I'm Dr. Neeraj Jain, Senior Consultant Spine and Pain Specialist. Now, this program is for public awareness to do with the back pain and sciatica. Why there is a back pain, why it's becoming so rampant. Now, let's understand the statistics part of it. At any point of time, 20% of population will have a back pain as a main problem. And of them, almost 5% have a serious back pain which really needs a hospital treatment. And over a period of lifetime, 80% population will have back pain one other point of time in their life. With such a rampant problem, why the problem? This is because this evolutionary pang. We were four pedal, now become bipedal. Now what is happening is because the evolution is not complete, so there is a common reason for back pain. Now this become commoner in younger age group because in our father and forefathers, people used to have a lot of physical activity, lot of work, lot of manual labor, which is really gone from the younger generation these days, and they become so comfort oriented. That is why the back pain is becoming more and more common. People who are manual laborers, they have a less of back pain than people who are in the office chairs and who are in the couch and sofas. So it's a couch and slouch is one big problem because of the back pain, because people have a very comfort zone of sofas and they keep eating around, they keep gaining weight, and there's no physical activity, and they have a lot of traveling, lot of distance traveling. People grow from Delhi to Gurgaon, there's about an hour or 2 hours of traffic traveling, and they have a office sitting job. People with the BPOs, people have a desk job, lot of computer job. They have a more reason for the back pain. Another problem which is commoner these days is a neck pain, because a lot of texting is going on. People do a lot of mobile texting these days, and this is the reason they are getting more and more upper back pain and the neck pain also. So this is called a text neck syndrome. Now the treatment to the whole thing is better be conscious, do a lot of exercise and be active as far as possible, do a lot of muscle activity. If you can't manage an exercise in the weekdays time because you're busy, you can do it a weekend. You can do half an hour, 2 days, Saturday, Sunday, and that will be good enough. You should keep your muscle strength strong. Another thing is, you better be conscious. Now this is to do with the weightlifting technique. How you lift your weight, what is your posture. The one commonest reason for back pain is a posture. If you do a correction on your posture, half the problem is over. So the spine is made for as a S shape. Now when we start sitting slouchy, this becomes C shape. Now when it's C shape, there is more loading on the disc, and that this starts getting weak and weak over a period of time. Now what happens is there is a back pain for some years, maybe months and years, and suddenly one day there's a back pain is gone and the leg pain starts. Now typically the disc ruptures and it presses on the nerve. Now disc is present in the disc area. Now as soon as it ruptures, it presses on the nerve at the back side, is the spinal cord as well as the nerve. Now once the spinal cord and nerves are getting pressed, the pain goes down the leg. This becomes sciatic pain. Earlier there used to be a kind of a rest and a physiotherapy. You should always try 4 weeks of treatment, but if it keeps coming again and again and it really hampers your life, bothers your life, and there's a weakness of the leg coming in, now these are the times you should really go and do some intervention. Earlier there used to be surgery only was the answer. Now we have a non-surgical treatment which is least invasive, which is done through needle in a daycare setting under local anesthesia, and patient discharged same day or maybe next day, and patient is back to work with the very next week. These treatments are modern treatments. They are akin to a kind of angioplasty in the heart. Either go for a bypass surgery or angioplasty in the heart. Same thing, either go for open spine surgery or go for a closed spine procedure. Now they are effective, equally effective, and they are least complicating. That's the best part of it. We should go in for, if need be, ideally we should avoid all this back pain issue and all, but if it really comes and happens to somebody, even in younger age group, I have seen even the people with a lot of weight, gym culture, like Salman Khan and all, they have given gym culture to the younger population. They do a lot of gymming, lot of weightlifting, but they don't have a right technique to this. They don't have right trainers. So they burst their disc, they keep coming. I keep seeing a lot of weightlifters with the burst disc coming very often. So what we can do in these situations, we can shrink the disc back. We have injection, ozone injection. We inject ozone inside the disc. If we shrink the disc back in its place, or we have a laser inside, we can debulk the disc with the laser, or we can fix the disc because there is a rupture of the disc at the back of it. We can seal this rupture after removing the disc or debulking the disc. This all can be done through needle. So this is the best modality available these days. This is lifelong, very effective, and surgery should be avoided as far as possible. But yes, there will be a situation where it's too bad, then surgery is the only answer, and we should avoid and avert as far as possible. Better be conscious of the fact that you have to be doing exercise, you have to be having a right control of your posture, and you have to be controlling on your weight also. With all this, you can avoid a back pain, which is 80% of the people have one time or the other. But don't let it get serious. That's the important message. Take good care of your spine and be healthy. Thank you.